Well, I think if we look at what has been announced, I think it's an admission of failure by the HSE and by the government. So to say that 320 patients a day in hospital trolleys has somehow become acceptable, in my view, in and of itself is unacceptable. And we are not starting at ground zero. I think what's incredible about these figures is that there will be hiding places for hospitals which have not been performing well, and there won't be reward for hospitals which have been performing well. So how is it that we have some hospitals that took, in my view, what should be applied right across the board, a zero tolerance approach to people in hospital trolleys? And I use my own city of Waterford, University Hospital Waterford, as a good example. It has been recognised as one of the better performing hospitals. It hasn't had a patient on a trolley for over 2 years. That's an incredible achievement, but that was done through teamwork, through taking that zero tolerance approach, fighting for additional capacity, which was got in some respects, not all respects, having good patient flow, having good relationships between the acute hospital service and community services. And essentially what we should be doing is replicating all of that good practice across other hospitals. And my fear is that we're normalising the trolley crisis by saying 320 is acceptable.
Well, they're not saying it's acceptable. You've said that twice. They're not saying it's acceptable. What they're saying, and what the Minister said this morning in the station, is that they have to start somewhere, and there is a process of reducing the numbers.
But once you put a figure of 320 on the table and you're saying that that's your aim, then you are saying it's acceptable at that point of
years
time.
Of overcrowding,
that 320.
They have to start
well, years of
overcrowding
overcrowding in hospitals isn't something I created. It's something that was created by the government parties. I've already given the examples twofold. One, we have to put the capacity into the hospitals, which isn't there. So part of it is, yes, some hospitals need more hospital beds. There needs to be much more alternative care pathways and the options of patients being discharged into the community, into the home, which is not always there. Stronger relationships between community services and acute hospital services. But crucially, mandating what works in Waterford, in Kilkenny. There's a number of examples. So how can it be that a small number of hospitals have zero patients on trolleys, and some hospitals in Limerick and in Galway and in Cork have 70 or 80
You've looked into the detail of this.
You're
the Sinn Féin health spokesperson for years now.
I've not only looked at the detail, I visited almost every hospital in the state over the last 2 years.
So how many extra beds do we need nationally?
Well, there was an ESRI report that was published only this year which says that we need at least 1,000 additional beds at a minimum, and then about 300 or 500 every year on top of that.
And how many staff?
Well, the staff would be about 4,000 or 5,000 additional to run those beds.
And how much would all of that cost?
Well, beds would cost in probably about €1 million per bed is what the HSE would estimate the cost. But obviously that has to be done over a reasonable time period. The Minister only a number of months ago announced a plan to deliver 1,500 beds. I haven't heard a peep from the Minister since. I'm not sure where that plan is. So it can be done that we can use the resources that we have in terms of capital investment to
But it's difficult
to
recruit,
build.
isn't it? That's the reality.
It is difficult to recruit. But again, I've been saying for some time to the Minister, we have to increase training places. We have to have a greater pipeline of graduates so that we can recruit. But you're missing the whole point here in terms of the target. I don't have a problem with setting targets as long as there isn't hiding places for some hospitals that are not performing better. So if you set a general target of 350 across all hospitals or 320 across all hospitals, then that means that some hospitals will perform well, other hospitals will not perform well. But as long as we reach the target or don't exceed the target of 320, all is okay.
So you're saying if
Whereas
you were
what
Minister,
we need to be doing is set a zero tolerance approach, should be the strategy. I'm not saying then that would happen overnight.
What would you do to a hospital that isn't performing?
A year. Well, I think as a starting point, and the new head of the HSE said he will initiate this, I would be making sure that the head of the HSE and I, if it was necessary as Minister, would be meeting with all of the hospital managers on a regular basis, seeking updates as to why some hospitals are not performing well, looking at and establishing what is best practice, what has worked in Kilkenny, what has worked in Waterford, what has worked in Drogheda, which has performed well in recent times.
But the Minister has done
all
of that.
So what would you do differently? But he hasn't.
What would you do differently to the Minister?
He hasn't, with respect, because if he was doing something differently, then that positive activity that we're seeing in Waterford would be mandated across all hospitals.
In terms of weeding out poorly performing hospitals, what would you do differently to the Minister? I mean, would you, for example, Sinn Féin has been critical of some elements of the public service in the past. Would you sack people if they weren't performing as managers?
Well, I don't think I would have the power to sack a hospital manager, because that would be a matter for the HSE. So I'm not going to step outside of my powers. That's not what a minister should do. What we need to get to is a point where the regional health areas, which need to be established, because what they will do is streamline management. So at the moment, we have community health organisations which run community services. We have hospital groups which run acute hospital services. We have too many layers of management. And what the regional health areas will be established to do is to streamline those health management layers, so that we have one single tier of management, and then those single tiers of management need to be held to account by the head of the HSE, but also by the minister. But I'm also accepting that in some hospitals it's not because of poor management that targets are not being met or that we have patients on trolleys. There's other factors. So, for example, in the Midwest, there's only one hospital, Limerick, that services that entire Midwest region. We closed emergency departments elsewhere. So we have this single point of failure, all of the patients going into Limerick. That is seen as one part of the problem, and it needs more capacity. So where more capacity is needed, it's the job of the minister to provide that capacity. In many areas that hasn't happened, but equally where we have good practice, doesn't it make sense that we mandate that good practice right across the system? And if we can do it in Waterford, if we can do it in Kilkenny, there's no reason why it can't be done elsewhere.
Okay, let me ask you finally about the new Children's Hospital. And the Minister was steadfast today. He said he doesn't accept that there's claims in from the developer of 0.8 billion, I think, in total for extra cash to finish the new hospital. So we don't know a completion date. But he's saying they're not getting that money. He's not ceding to that money yet. What is the best we can hope for in terms of this new hospital, in your opinion, in terms of completion date and total cost?
Well, I think it's outrageous that, again, at this point, we don't have a completion date. Obviously, there is discussions ongoing between the board and the main contractor in relation to those claims. I don't believe that the state should write a cheque for 750 million either. But I know that there is negotiations and discussions going on between the main contractor and the board to see what would be an appropriate figure. And I feel that there will be a settlement at some point. And the quicker that's arrived at, the better. And obviously, I want that to be the lowest possible amount for the taxpayer. But through FOI requests I submitted to the Department of Health a number of months ago, I asked how many meetings the Minister for Health had with the board of the hospital for the entirety of 2022 and for the first quarter of 2023, and the answer was zero. No formal meetings. Now, how can that be when you have a project that it seems we've lost control of?
He says he gets regular updates, in fairness.
Regular updates does not cut it when you have a crisis in this hospital.
He says he works closely with the chair of the board.
Well, you can defend the Minister's position and you're playing devil's advocate, which I know, I accept that. What I'm saying very clearly is that suggests the Minister has lost control, is sitting on the sidelines rather than being proactive. And I can tell you, if I had been Minister for Health during that time period, I would have regular meetings with the board, because there's three stakeholders here. There's the board, there's the contractor, who are not blameless and need to step up to the plate and provide the adequate resources to complete the project, but the Minister has to be the driver. If you're not even holding meetings, then what chance do we have?